when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs.
The lad who was driving got blood coming out of his face.
To save yours.
RTC truck.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear.
There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh yeah. He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high drama.
So apparently one's been stabbed in the arm, other in the leg.
You've got a wound up here somewhere, have you?
Yeah, I've got 5 on there.
High stakes.
Where's all that blood come from?
Out of his ear or out of his mouth.
Change of plan, we're going to tube him here, mate. He's arresting, so let's do a bit of CPR.
And high emotions.
I knew I'd hurt myself, but my main priority was the kids.
Which is understandable, really. It's quite a shock to the system when you're involved in a road traffic collision.
It's early evening at the Nostell Air Base, and pilot Owen is preparing to take off into the night.
Alright, I'll have some checks please, I'll put that MVG now. Okay, NV's just isn't working. Just not working? So is mine. Engines both to fly. Fly, engagement.
Owen's cockpit banter is legendary.
Ooh, that's a good one. Means my landing's gonna be shit. Right, 101, clear, all greens.
Paramedics Paul and Andy are heading south with Dr. Chris to reports of a double stabbing.
Going on to Gogs there. Gogs are working as advertised. But I just need to tweak that way. Right.
Owen's using night vision goggles to see in the dark. Chris is getting updates from ambulance control.
So apparently one's been stabbed in the hand, arm, other in the leg buttock. Okay.
It's happened in Wather-upon-Dearne.
Okay, so nothing to the right, any post left, got them going across. Okay, so commit to this field now. Large field, so if there's was a post beside that, I'd know about it. Got a light stanchion behind me, which is the...
We cleared the wires to the rear, but obviously still got those wires in.
Yeah, copied. You can turn it off, I think, if you want to, mate.
Roger.
Off. And... Right, so I've got the wire 12 o'clock, I've got it going off the way towards the 1 o'clock. I've got the wind as well.
Owen's landing on a patch of waste ground close to a police training school.
Well, this is probably the best place now, isn't it? You can just go across the road there.
And then into
All right.
complex.
Goggles coming up then.
Roger.
Okay, got the light stanchion there.
Yep, got
Right,
that.
so, Mike, put the atrium in, please, mate. You identify the atrium?
Yep, atrium.
Okay, that's the atrium off, thank you. Just a tiny bit muddy, but it hasn't rained in 3 days, so should be guys. MMI.
So that's good.
Cheers, mate, you're awesome. Right, that's us down then, minute 17.
And now we've landed.
So it's landed in the Wath area of Doncaster for reports of 2 people being stabbed. It's not too far from Doncaster. We're just going to shut down and get out and get to sea. Right, we're up in the back. Nobody's approaching the aircraft, which is good. Okay, so engine 1, that's good. Right, my goggles are off then.
Dr. Chris and Andy are heading out across country to meet local paramedics already caring for the victims.
Not as muddy as it looks, is it?
No, it's all right, isn't it?
There might be a big drop. I've got a funny feeling on the side of it.
Do you reckon?
We're all right.
Watch your footing.
The crime scene has been sealed off. A taxi driver and his passenger, who's also a friend, are the victims. Apparently it was an attempted robbery by men who were after his takings.
Hiya. How we doing, mate? I'll just leave this out of you.
Yeah.
How we doing?
Andy, I'll stay out just for now, all right?
All right, yeah. How we doing?
Right, Luke's got, I think, 4 stab wounds to his leg and buttock. Maybe one what's gone all the way through there, quite a large one there, and one on his buttock.
Okay.
The driver fled the scene of the attack and drove to the police training school for help.
There's been hammers involved, but they're both deny being hit with the hammers. But they've both got stab wounds. Luke, who's the driver, he's sat. He's got 5 stab wounds to the left arm, one to kind of like just the crease of the arm here, anterior axilla kind of location. Can't see wound beds on any of them. Adam has got 4. One looks through and through.
It was a frenzied attack, and it sounds like the 2 men are lucky to be alive.
They said the knife was about this long. So anterior left thigh, and then kind of medial thigh with potentially an exit wound that's smaller than this one, and then left buttock as well. All veins bleeding, all GCS 15.
So that buttock's not hosing, is it?
No.
They can bleed quite a bit then.
No.
Fair enough.
Dr. Chris is an A&E consultant in inner city Hull. He knows wounds like this can be fatal if not treated immediately. The first paramedic to arrive helps staunch the blood.
We've been called to a couple of guys that are alleged to have been stabbed this evening at a separate location to where we are now, and then obviously they've driven away to escape the attackers. We've been contacted obviously to come and give an assessment of them to see what their injuries are. One had walked onto the ambulance, and the other one, who'd been stabbed through his upper left thigh, had been loaded onto the stretcher and taken onto the ambulance that way.
Andy's carried out his own assessment.
So we've got 2 patients. Yeah. We've got Luke laid on a stretcher. Slightly tacky, 105. Blood pressure's OK. He's got some IV powder up. I've asked his mate, what does he look like? And he says, he looks all right. Because I thought he looked a bit pale, but I don't know if it's because of what's gone on, to be honest with you. Adam, who's sat in a chair behind him, he's got about ×5 wounds to his forearm, obviously protective wounds, and he's got ×1 to the axilla delt area. My thought was that, essentially, he'll need to go because he's got some vascular nerve compromise types of, well, nerve compromise. And that one to the buttock could potentially lead to some nasty bleeding.
Well, can I have a real quick gander at that? Sorry, you can keep that, mate. I'll leave it.
Dr. Chris is concerned one of the men's wounds is potentially life-threatening if the bleeding worsens.
Hi, bud.
He wants to see driver Adam's injuries.
My name's Chris, I'm one at Senior Doctors. I'll let you do that. You've got a wound up here somewhere, have you? Yes. Can I have a quick gander where it is that all right, mate?
Just take it off.
It's all right.
It's only mine, yeah.
Small.
Can you just lift your arm out for me a little bit? You've got quite a few there, haven't you?
Yeah, I've got 5 on there.
Put your hand on, lift it right up the ceiling.
We're all gaping, so
Okay. Which side did it come at you from?
From our left side.
Your side, okay. Fair enough. I think
it looks like front delt, doesn't it?
It does, but you never know.
He has got some numbness in that
both.
arm.
Does he? Yeah. Oh, yeah. I think. And what did he attack you with?
A knife. A knife.
Little knife, big knife.
I don't know.
Okay. Fine.
In there, it's literally.
It's a massive gash.
Yeah.
Well,
in his
yeah. I mean, ultimately, if somebody's coming out from the right-hand side, that could be intrathoracic. So I think MTC.
Right.
So we're struggling for a second DCA.
And it makes sense just to take them both, doesn't it?
So they want to stay together.
We can make Northern General happy, don't worry.
Right.
Do you
want me to give him a bell?
Ambulances are in short supply, so both men will go to hospital together by road. It means Dr. Chris can deliver life-saving blood transfusion more easily if Adam deteriorates.
You give them a bell. If you have any issues, I'll speak to them.
Well, that TXA, do you think they need it?
I'll give them both TXA.
Yeah, right, okay.
Yeah.
Hi, it's Andy off the Air Ambulance. I've got a trauma call for you.
They're going to be taken to the Regional Trauma Centre in Sheffield.
They were quite concerned about one of the guys. He's got a wound right on the kind of fold of his arm and his chest. And certainly somebody attacking from the right-hand side, that could well be in his chest. So we'll leave it a couple of minutes to get down to Northern General, which is a major trauma centre with both the patients.
What we're going to do is I'm going to go back in the aircraft and meet the team at Northern. Chris and Andy are going to be in the DCA.
So once we've set off, we'll be about 25-30 minutes. The helicopter will be coming in and landing, but have no patient on board. So is it OK just to inform the security that that's what's happening? Paul, about 10 to 15 minutes before you land. It's about time we get
15 minutes.
15 minutes. About 15 minutes for the helicopter, but no patient. OK.
Get a seat first.
Both of them need to go through to the major trauma centre. Obviously, on a weekend, we need to make sure that we can get them there as rapidly as possible. The ambulance service is really busy at the minute. So what we've decided to do is, although there's a paramedic on the ambulance already, Chris and Andy have gone with them just in case they need any extra support and any critical care interventions that might be required. Because one of them's been stabbed somewhere close to his chest, if that patient goes into cardiac arrest, then Chris and Andy will probably have to do a thoracotomy, which is where they open the chest to get access to the heart and suture any wounds inside and hopefully get the heart restarted again. So it's difficult to do that in the back of a moving helicopter, whereas an ambulance can pull up at the side of the road. So it is a bit more easy to treat sometimes in the ambulance.
As police launch a hunt for the attackers, Dr. Chris and paramedic Andy hit the road. 12 miles away, trauma surgeons are preparing to operate. This will be a long night for the two victims and their families. Every day, the air desk monitors thousands of 999 calls. Dispatcher Pete has a feeling about one of them.
54-year-old has been cycling for 3 hours and has now got chest pain. How old are you? 46. He's there.
The call is coming in from a remote village on the Yorkshire Wolds.
The spider sense is tingling.
Yep, spider senses.
It sounds like a lethal heart attack. He's scrambling Helimed 99 with paramedics Andy and Sammy on board.
Okay, I'll lift a quick power check and maybe helipad departure over the hangar. Everyone happy? Yep, cool.
They're heading to the area where Dr. Brian lives. His local knowledge could be useful.
Due south of Bolton. Yep, got it there. Bolton and Norton, yeah. There we go. That one. In that village there. Yeah. Air desk 99. I'll get a good grid off him.
Receiving, go ahead.
Yeah, mate, couldn't heading towards Bolton. Have you got the grid reference, please?
It's Sierra Echo 03608. Confirmed inferior STEMI by specialist paramedic on scene, over.
A STEMI is medical jargon for one of the most lethal forms of heart attack.
It's confirmed by specialist paramedic.
Yeah, I heard that bit.
Castle Hill's 25 miles away.
From the scene. If it's a specialist paramedic on scene, we don't know if there's a land ambulance over there.
It's a rural area. We'll get right up to it, Sammy. We're only 6 minutes away, and it's not a good driving journey. Okay.
Highly like we're going to take then.
The team are already planning the patient's flight to the cardiac unit at Castle Hill Hospital near Hull.
A gentleman in his mid-50s who is a keen cyclist by the sounds of things, who's developed chest pain and is known to have some risk factors for ischemic heart disease. There's a specialist paramedic on site that said he's actually having a heart attack as we speak. Helmet 99 Alpha is letting down at the thing. Helmet 99 Alpha, Roger. CT check.
Pilot Harry's landing his medics in a cornfield just outside the village.
Okay, I've got one domestic there, but I can see where it runs. Yeah, up until that pole there. And now I can see where it's going, it's down the road, so I'm happy with that. Okay, that is LDP. Go up into the corner here. Right, lever is fully down, clear that strap.
Thank you.
A local paramedic has already taken a heart trace from their patient.
Hello, sir.
It's a bit simple chest pain, 5 out of 10, after cycling 50 miles, I think.
Paul Deadman is super fit.
How much you paying now?
1 or 2.
1 or 2. Great.
He was out on a marathon ride from his home in Hull.
We just stick a pair of pads on him.
Do you want to do it on yours?
Castle Hill, yeah, definitely on 2 hours. Castle Hill, have you already spoken to them?
I'll leave it to you, I didn't know which one.
All right, so it will be. Is Castle Hill, I'm assuming Castle Hill's my nearest.
It's nearest, whether it's the easiest. It's easiest. Yeah.
Sammy is concerned Paul could go into cardiac arrest at any moment. She wants to apply chest pads that will allow her to shock his heart back into rhythm.
What's your first name again?
Paul.
I'm Sammy. How old are you?
54.
Fabulous. Thinking inferior STEMI, don't you?
Yeah.
And it started at?
At 12.
12,
We've
30.
done about another 20 mile on top of it.
We were 50 miles into the ride and my friend just got up this hill and he was complaining of chest pains. So he got off the bike, laid down and then deteriorated. So I couldn't get a phone signal, so I came into this house and then managed to call got to call the ambulance.
Have you felt dizzy at all or anything like that?
When I had my first episode, I just felt a little bit.
Today? Today?
Today,
yeah.
He has had a few issues with his heart in the past, mainly narrowed arteries in his heart.
Right, then we just need to get you onto this trolley.
He's normally quite fit.
Hello, it's Sammy from Helimed 99. I have a 54-year-old gentleman I'd like to bring in to you, please.
If you let people know who need to know.
You don't need to speak to your wife.
You really want to bother him?
It's worth bothering her.
He's showing inferior STEMI. He's received ondansetron, GTN. He said he's had the full package, so he's had aspirin as well. He is cannulated. His pain score was 4 out of 10 on the crew arrival. He's now saying it's about a 1 out of 10. Our intention is to fly him to you. Thank you. Bye. Bye.
Thank you very much.
Paul doesn't realise it, but they're preparing to resuscitate him in flight if it becomes necessary. The blue board is a machine to deliver CPR.
There's a lot of this stuff is precautionary today, okay? Because when we're flying, we can't really do that much.
I can get on there if you want.
Give us a second or two, just wait for Andy to come round. You ready, Andy?
99, patient 54-year-old male has been accepted for PPCI.
Our ETA will be approximately 12 to 15 minutes.
Yeah, that's all received. You need a secondary transfer, Emma.
Roger, and please may I have a secondary transfer? Over.
This gentleman's having an MI. He's been out cycling. He's pretty fit. Cycles 100 miles a day. But he also has a history of a AAA, so that's a bit of a bulging carbuncle in his main aorta. So time critical, got to go.
Okay, I'm going to lift to the hover, go out into the field, and then it'll be a helipad departure.
Paul's on his way to specialists who will operate immediately to remove the blockage causing his attack using a microscopic grab.
NS99 lifted for Castle Hill. He definitely had a heart attack. He's been well for the last 3 or 4 since it happened at midday. So hopefully it should be an uneventful landing and transfer into Castle Hill where we'll do some interventions to hopefully restore the blood supply to his heart.
At 150 miles per hour, it's taken just 15 minutes to fly from the heart of the Wolds to the outskirts of Hull.
NS99 on approach, Castle Hill.
Right, thank you. Your secondary should be in place.
Yeah, visual. Yeah, visual, thank you.
Harry's touching down on the hospital helipad.
There.
It's just a short drive from the cardiac unit.
NS99 landed.
Paul's now minutes from treatment.
Right, off we go.
Inside the hospital, a surgical team is on standby. In Sheffield, the victims of a double stabbing are recovering after a total of 14 hours of surgery to repair wounds inflicted by a knife and a pickaxe. For taxi driver Adam, it was a terrifying experience.
I got slashed on my left hand side a few times around here, and then it comes all the way up here like. It's literally like zigzags all over. I got a punched up through here, and then it was literally pumping up with blood, and then it literally squirting out with blood, pumping up with blood, squirting out with blood.
A man has been jailed for 4 years for robbery, and police are looking for another suspect. The psychological effects were just as serious.
I don't go out half the time. Sometimes I'll go out, but I'm always off the look over my shoulder.
And the attack has made him value family life even more.
At the start of it all, I couldn't pick up my kids at all. I could pick them up with my right hand. I could pick up one of them, but then obviously one will just get left out. But like now, I've like worked at it. I've tried to get it stronger, so now I can actually pick them up. I can throw them up in the air. We can actually play. We can do stuff now. So I actually feel like a dad again now.
It's biking season on North Yorkshire's roads, and hundreds of riders are heading for a cafe near Selby.
Go to the back, clear on the left.
But on a country road, one biker is fighting for his life.
Come through his motorbike V car.
Yeah, he's not very well apparently. Poorly by the sound of it. I don't know if he's breathing.
Yeah.
Certainly wasn't conscious, it says.
paramedics Sam and Pete are only minutes away, with Dr. Jez.
We're on our way to Sherwood and Elmet, which is biking country. It's a nice day today, though it's kind of later on in the year. Reports of a motorcyclist versus a car. He sounds very poorly. In fact, we've just got an update to say he's in cardiac arrest. So we'll get there, assess how he is in terms of does he have injuries that potentially he can survive from. If so, we may run through a kind of process which involves putting a tube in his airway, ventilating his lungs, putting some holes in his chest to relieve any build-up of air pressure that might be there and give him some fluids. It may be doing that we get a pulse back, but generally if patients are in cardiac arrest at this stage after major trauma, the outcome's usually fairly bleak.
They're homing in on a road that is one of the most deadly in the UK for bikers.
It's a bit of luck really or bad luck when you come off your bike as to what you hit. So if you hit something fairly solid that doesn't distribute the forces very easily, you can sustain very significant internal injuries.
Where is it?
I think we're first on scene as well, aren't we?
Pilot Jeff's aiming for a landing metres from the wreckage.
Wind's coming from there, from them anyway, so I won't get too close, but I'll stick it just in front of that FedEx truck.
Right. Tail's now clear of the wires behind us, mate. Got wires to our left still.
I'll just stick it on these tracks here.
There's a wire just to our right, mate. Have you got that?
Got that.
Motorists who've been giving the biker CPR are desperate for the team's help.
I'll take suction and primary.
Okay, mate, yeah, I'll take the defib and the secondary. You've got a crew here yet?
Nope.
Good to go.
Right, I'm out.
The high-powered superbike hit a car before its rider was catapulted off.
We'll get a line in him, Sam. Get him tubed in a sec, mate.
Backup is arriving. The biker has a major head injury and his chest is crushed.
Where's all that blood come from?
I think it's coming out either out of his ear or out of his mouth.
Is that brain?
Well, I pulled a load of, when I suctioned out of his airway, I brought something that I'm not sure what it was.
The biker's clinging to life.
Right. Let's do some thoracostomies on him as he is here, Pete. Sam?
Then, his heart falters.
Change of plan, we're going to tube him here, mate. He's arresting, so... Yeah, I'll have a laryngoscope, size 8 tube and a bougie, mate, please. We're going to get a couple of thoracostomies done, Sam. Let's do a bit of CPR. Do you want to come out of the way? He's arrested, mate, so...
The team are starting CPR to keep blood flowing to his brain, at the same time as operating to re-inflate his collapsed lungs, a procedure known as a thoracostomy.
Excellent, so we'll get some adrenaline in and some fluids, and I think he's definitely, right side of his ribs are definitely gone, so we'll... Could you just hold a blanket up above my head just to keep that sunlight off him, please?
Dr. Jez is using all his clinical skills to keep his patient alive. He has to think quickly.
He's got a low output state, he's breathing, so... Right, bougie, mate, please.
Now he's going to anaesthetise the biker to keep his airway open. His heart is still not responding.
Yeah, I've not seen that go down, but I think it's in the right place. You got it now, mate? Bougie. Take the bougie out, mate, please. Bit of air in this cuff, mate. Carry on CPR. It's got a low output state. We've got CO2 on there, mate. Yeah, we've got CO2. Good.
Do you want me to move my coat now, yeah?
Yeah, you're fine, mate, now. Right, do you want to do a thoracostomy on that right side, Sam?
Yeah.
At last, his heart is beginning to respond to CPR and a shot of adrenaline, a powerful hormone.
No, mate, he's got a central pulse just.
We've got Roscoe.
We have only just, haven't we? That's the thing. Let's just get these done. See if we get an improvement, mate, and then probably yes. Happy where you're going to go, mate? About there, Pete. In that bit there.
Right, just watch your leg and get the scalpel out.
He's not going to be the easiest chaps, I'm afraid, but thank you very much.
They are going to cut holes in the side of the biker's chest to allow fluid crushing his lungs to escape.
It's not going to be easy, Sam, so hit the rib and then just step off it, mate, so you're on top of it.
but the biker's size is making it hard.
You feel the rib?
Yeah, it feels really far in.
It is far in. He's a big boy.
Absolutely miles, isn't it?
Yeah, he's a big boy. So, you get your finger in there, Pete?
Yeah, I've got my finger in.
Lung
I
up.
feel his lung.
Up on that side?
Yeah.
Lovely. Excellent. I think we're going to have to... Pete, do you want to just... Please, yeah, I'm going to paralyse him so he stops breathing.
Dr. Jez wants to be able to pump air into his lungs artificially. It would deliver more oxygen to his brain.
Can you feel his lung coming up? You can feel his lung. Lovely, right.
No pulse.
We lost his pulse again. He's got an entitled CO2, isn't he?
Yeah, he's really weak.
Their patient is at death's door. His condition calls for cool thinking and skill.
Did he get any adrenaline in the end?
He's had adrenaline.
He's had a milligram of adrenaline, has he?
He's had one lot of adrenaline, so...
Lovely. Can I have we got some more adrenaline?
The team don't even know who the biker is. His pupils are wide open despite the sun. It's a classic sign of a major brain injury.
So his heart rate has gone up and his end tidals... Go on, so we've got an end tidal. We haven't managed to get a BP on him yet, have we?
Right, he's gone really tacky.
He has gone very tacky, hasn't he?
It's becoming obvious he must have hit something when he was thrown off to cause his multiple injuries.
Yeah, I just want to check he's not going to arrest again in the next couple of minutes, Sam. If he is, then it would all seem...
Dr. Jez needs to understand the mechanics of the accident to be able to predict any injuries he can't see.
So do we know what's happened? Has he just come off and hit, or has he hit a car?
It's a car, I think.
He has hit a car. Oh, he's been coming past this car, or he's just clipped it.
A local paramedic has spoken to the motorist involved.
From the history from the driver,
yeah,
he says he was coming right on the line, looking forwards. The bike was coming up behind him.
Right.
He doesn't know what happened, but he thinks there's something wrong with the tyre of his car, and it pulled him across to the left.
Ah.
And then he doesn't know how he's collided with him, but he has.
So basically, he's hit that bike, and then he's.
And then he's sent him off road.
He's obviously gone off the road because his bike's been in the field at some.
Looking at it, I think he's hit that tree.
Let's just go and have a quick look. That would all explain. He's hit something immovable, isn't he?
If he has hit the tree, it's likely he has very serious internal injuries. He needs hospital care immediately. "30 miles away, at RAF Topcliffe, the North Yorkshire Air Base, another case is coming in.
Topcliffe.
Hello, I've got a job for you. It's on the A168 between Thirsk and Northallerton. It's a 3-car RTC, one patient unconscious. Cheers, thank you, bye.
The crew of Helimed 98 are scrambling to the scene.
Do they need some backup? Not at the moment.
Paramedics Lisa and Kit are on the case.
Pre-takeoffs, please.
Engines best to flight.
Best to flight, and they are guarded.
Confirmed. Doors and harnesses.
Mine's good, my side.
Close and secure rear.
Close and secure front left. Brief.
Let's go. In fact, I'll dial that up first because that's who we're going to talk to. Right, all good. And lefty.
Pilot Chris will have his medics there in less than 5 minutes.
Blanco Douglas, Helimed 98 Alpha, lifting a departing outbound to the north. Blanco Douglas. Yeah, my friends, come go.
We're on the way to a car accident. We've been told that there's multiple patients and one of them might be trapped and unconscious, so it's imperative that we get there as quick as we can.
The crash has happened on a main road out of the market town of Thirsk.
I've just seen a DCA. Can you just see?
Going up, but
yeah,
it's
there's
above.
a lorry and a few.
Yep.
There's a bit of standing traffic. We've been to an RTC on here before, haven't we?
Well, it's down here though.
Is that where we were?
Yeah, down below. This is a bit further up.
Looks like there's a DCA just running to it, Kate.
I think you've got people the other side as well.
I think there's some IVs already on scene. I don't know if I think it's police.
Oh, look at that. Just by the truck there happens to be a gate. I think we'll land there. It's going to be a bit muddy, team. Everyone happy where we go?
Yep.
Yeah, this looks messy, doesn't it?
It does look messy. A bad road, this.
I don't know. I've never had a problem on it.
It's chances that just try overtake and stuff in.
Have you got the wagon facing this way on the left-hand side of the road?
Yeah, cheers, Chris.
There's another truck and a patient at 10 o'clock.
Yeah. It's a sad team, but it's a muddy one. Sorry about that, but this is probably the best bit of ground around as well, all round.
Wreckage is littering the road. A family car has been in collision with a van. 2 children were in the car.
They've hit more or less head on. Speed we don't really know, but it is quite a fast road and there are quite a lot of twists and bends in it, which makes it quite precarious at times. One vehicle had a gentleman in, the other car had a lady and 2 young children. The lady's sort of trapped mechanically because of the impact to the car.
Basically, her pain score is now 7, but she is clinically tender on that splenic region.
Absolutely, fine.
I'm just thinking she's a very, very fit and active woman normally. Is there something?
She's compensating, you're thinking?
Is there something?
Okay.
She is C-spine immobilised, obviously. BPs haven't really changed.
Do you think she'll be able to step out with assistance control and then lie down?
We haven't been.
Rather than pull her?
We could look at that.
Yeah.
The 2 young children are out, sat in bystander cars. One's fast asleep and the other one's sat chatting to a gentleman that was travelling along the road as well. Mum's quite anxious, which is understandable really. It's quite a shock to the system when you're involved in a road traffic collision. It doesn't help the time of year, it's cold, so straight away the elements of the weather start to upset you alongside, the insult that you've sustained and the shock of the collision.
Firefighters are still fighting to free Tamara Kitchen from her wrecked car. The pain she's suffering could be a sign of an internal injury, but Kit is optimistic.
It's a really safe car, there's no intrusion. Don't know what's going to have injured her spleen. She's restrained, airbags, seat belts, no.
Get her out on stretcher and have a proper, yeah. She might just be sort of scrunched up and spasming and all tensed, abdominal muscles tensed up. How are you getting on?
We're just going to get this SAM splint in and then we're going to try the stand and turn.
Right. Me and my daughter were driving to Thirsk. We were following the lady in the white car. First thing I did, I got out and being an ex-military medic, I went and made sure everybody was, checked on the lady with the 2 kids in the car first because I thought it would be more prudent. I'm fine, I've just cut my hand and I banged my wrist and other than that a little bit of shock, but I'm thankful to have walked away unscathed.
It's time to free Tamara.
Do you want me to hold that down for you?
They're going to immobilise her in case of a spinal injury.
Bring your legs down this way, sweetheart, okay?
Initially the crew was sort of saying that they were happy that she was stable with a little bit of abdominal pain but no major concerns, all the rubs were stable.
Well done.
They've just asked us as they're getting her out just to reassess her. They're not sure that there might be something underlying, some underlying hidden bleeding, so we'll check her over and take it from there.
How are you feeling?
Hi.
Hello. So what happened, Tamara?
I was driving to my nan's.
Right, so you had your seatbelt on?
Yeah.
Yeah, and the airbags have come out. And could you not open the door as well, so you were stuck in? And as you've just stood up now, whereabouts is your pain?
In your arm.
In your arm, your right arm. Anywhere else?
The one lower tummy hurts.
The bottom of your tummy. Can we have a quick look? Is that all right? Yeah. So what we'll do, we'll have another quick look right from top to bottom of you and just make sure there's nothing that we're missing, okay?
Is it still 8 out of 10, the pain?
It's about a 6.
About a 6. And where is the pain mainly?
Like there where the seatbelt was.
Down across the abdomen.
Tamara is going to be driven to the major trauma centre in Middlesbrough. It's hoped scans will identify what's causing her pain. On a country road in North Yorkshire, the team are struggling to save a biker fighting for his life after a high-speed crash. Dr. Jez needs to know how he came by his injuries.
Yeah, at the moment he's looking really poorly. He's on a big bike, big speed. He has some things hit the tree here, so there's obviously marks on that tree which are fresher. That's probably the bike or the biker, and he's done that. He's got really significant injuries. I'd be survived if he's going to pull through this. At the moment he has barely got a pulse, but he has. So we're going to give him some blood and we're going to fly him to the major trauma centre. But this looks pretty grim, I'm afraid. Well, we'll give him blood then, Sam. Do you want to prep that, mate, and we'll get him packaged to go, and we'll get cracking. Do we think all that blood is from his airway?
From his head.
From his head.
Head and his airway. He's got blood coming out of his left ear, right ear not so much. Blood coming out of his nose. Possibly orbital as well.
Clean behind. I've had
there's definitely a lot of blood in that ear.
They're going to fly him to the major trauma centre in Leeds, 15 miles away.
Hello, it's Jez Pinnell, doctor on Helimed. We're going to be bringing you an adult male trauma. He's a motorcyclist who's collided with a tree at high speed. He was peri-arrest, he still is peri-arrest. He's been intubated, he's had bilateral thoracostomies. We're about to give him blood. It appears to be mainly head. One pupil below and GCS3 prior to getting his tube down. He may arrest before we get to you, but we're going to be coming by air from Sherburn, so we'll probably be with you in about 20 minutes or so. Yeah. At the moment we haven't got a blood pressure, we've never had a blood pressure. He's got a heart rate of about 110 with a barely palpable central pulse. He's got an end tidal CO2.
So ready? Ready, steady, move.
Are we okay?
Yeah.
Too fast.
You all right here?
Okay, go steady here.
Right guys, so we're going to go to the tail and we're going to come in from our right hand side. So we're going to go basically wheel around the tail, go from the far side of the aircraft. Okay, so head first in guys. So watch your heads.
The team will be working on the biker throughout the flight, ensuring his heart keeps beating. Blood transfusion is being prepared.
095 618 461 227.
Yep, and that looks okay to me. Do you want to check the other unit whilst we're here as well? Well, we'll give him that one for now. Probably give him the other one on the way, mate.
Right, Jeff. Yep. Are you okay to move forward?
Yep.
Yeah, we're in. So, gentleman's basically about to arrest any minute. Quickest way is to get into LGI. He's sustained quite a very serious head injury. He's got lots of blood in his lungs, his airway's shocking. We've got a tube in there, so we're ventilating for him. We've given him some fluid, we've given him some drugs to stop him bleeding too much, and Jez has given him some drugs basically to paralyse sort of what consciousness is left. So it just makes it easier for him to breathe. It's actually less stress on his body. So the idea now is to basically get to Leeds as quick as we can.
It's a 5-minute flight.
Keep an eye on that canyon because I'm just squeezing the blood through, mate.
Yeah.
Pilot Jeff's landed next to a busy airfield.
Quick look behind me because we're close to Sherburn, and then that'll be all. Oh, looks good behind as far as I can see, mate. Cheers, thanks. He's got an end tidal, so he must have some cardiac output with an end tidal of 4.7.
Yeah. That ECG looks fairly organised.
Yeah, this is all brain failure.
On the roof of Leeds General Infirmary, firefighters are preparing for the helicopter's arrival.
Oh, mate, we're inbound. We'll be with you in a little over 3 minutes. Yeah, copy that. Great one. Come with you a bit.
Jez is busy pumping donor blood into his patient.
This gentleman is desperately sick. We don't know anything about him. We don't know how old he is. He was riding a very big, powerful motorbike, and he's gone to overtake a car. He's collided somehow with the back of the car on the driver's side, and then looks like his bike or him has hit a tree. And that's the issue, that he's hit an immovable object. If he'd have missed the tree and just gone across the field, he probably wouldn't be as badly injured. He's got multiple injuries, and we've put a tube down. We're breathing for him. We've put holes in his chest wall to check that his lungs are both up, and they are. He's had some fluid and some drugs to get his blood pressure a bit better, and we're giving him some blood as well. Hospital are aware that how poor he is, so they'll probably have blood on standby for when we arrive. The main issue, I think, is his head actually, and his pupils are both blown, which is a really bad sign at this stage. So, I think even with a pulse, I think unfortunately his outlook looks terrible.
That's 99 landed LJ.
I think this is all probably head with some blood loss from his base of skull fracture.
Right, mate, go. You ready? Yeah. Okay, yep. Right, someone just watch his tube, chaps. Ventilating 4.6, yeah, good.
Good to go?
Yeah, let's go.
A full trauma team has been called to resus to take over the biker's care.
Hands on the yellow scoop.
Hands on the scoop.
Everybody ready? Okay, ready, steady, and move. Right. Unknown male. I think he's probably in his 50s or 60s, riding a big, powerful motorbike. He's been going for an overtake on a car. He's clipped the back end of the car, and then there's a tree which has clearly been hit by him or his bike. Yep. His bike's then gone into a field, and then he's ended up in the middle of the road. The report was that he was in cardiac arrest. So he was intubated with no drugs. He's had bilateral thoracostomies, both lungs are up. got an output with 1 milligram of adrenaline and a bit of fluid, and has maintained an output, although he's still in a low cardiac output state. Right pupil was blown on scene, both pupils look to be blown now. So injuries, he's clearly got a head injury, he's got some right-sided rib fractures, but his lungs up. Query abdomen, query pelvis, we've put a binder on, his right femur's gone, and we think his right humerus is gone. There was a lot of blood on scene. I think it was mainly from his base of skull fracture. It was coming out his mouth and his ears.
The biker is going straight to the scanner. It's vital specialists can assess his head injury and work out how to stop blood loss in his chest. His life is on the line. It quickly emerges that the biker is 63-year-old Ian Stewart, a semi-retired businessman who'd been married for 34 years to wife Fiona.
I got that knock on the front door and they said, we've been asked to get you to the LGI in Leeds as quickly as possible.
At the hospital, she found Ian on life support.
They came and said that there was no brain activity and asked for our permission to turn the things that were keeping him alive off. If in that moment I could have made a decision for him to live and he would have been stuck in a wheelchair for the rest of his life, and you know, the decision was for him, it wasn't for me and his children and grandchildren that he left behind.
But she's very grateful she was able to sit by her husband's bedside for the last time.
Myself and my 2 children were able to see him in the hospital and talk to him and have them last special moments with him, really, which without the intervention of the doctor and the medical team at the roadside, that wouldn't have happened.
The driver of the car involved was jailed for 7 months after he admitted causing death by careless driving.
She's restrained, airbags, seat belts, no.
Mum of 2 Tamara broke her arm in 2 places and her finger, but her children escaped with bruises in the massive head-on impact.
I knew I'd hurt myself. I could feel it in my wrist. I was in so much pain I couldn't move it. But my main priority was the kids, so when everyone was coming over to try and help me, so I was just like, get my kids, sort my kids out, someone look after my kids.
I have a 54-year-old gentleman I'd like to bring into you, please.
Incredibly, cyclist Paul walked out of hospital 48 hours after his admission for his heart attack.
The fact that I was airlifted has had a huge impact on my well-being. The strength of my heart muscle could have been severely impacted, and of course people can suffer cardiac arrest if the heart attack isn't treated quickly enough. The air ambulance prevented any of that. I don't want to imagine what may have happened if I hadn't have received that speedy response.